Welcome back. The Health Department says work will continue despite Health Minister Zweli Mkhize contracting COVID-19. Mkhize and his wife are self-isolating at home. To tell us more about the running of the department while the minister is away, I'm joined by Director-General Dr Sandile Buthelezi. Thank you so much for your time, DG. Appreciate it. First question, of course, is how's the minister and his wife doing this hour?
Yes, good afternoon and good afternoon to the viewers. Yes, we can assure the public that the minister is doing well, though he's tested positive together with his wife, Dr. Mkhize. So they are self-isolating at home, and we have made arrangements also to test the contacts of the people that have been in contact with the minister and his family.
Yeah. So how does the minister being off for 10 days affect the running of the health department?
No, the minister is comfortable that the work will continue, and I must just confirm that we are in contact with the minister virtually in case we need anything. But in terms of administration, the management of the department is running. We had our usual morning executive management meeting, and the deputy minister is there, so we are also just working together with the deputy minister to ensure continuity of services.
Now, we're seeing the daily numbers increase. At last count, it was 1,662 new cases. Is this a sign of a second wave?
Well, we won't say we're there yet. We will be having our meeting of the Ministerial Advisory Committee, or the scientists that are advising us this week, just to look at the numbers. Yes, I must say we are a bit concerned over the last few days. We've seen numbers going closer to 2,000, but we are doing very strict monitoring to ensure that we pick up if there are issues. So we will be doing an analysis until Thursday, then our Scientific Advisory Committee will be advising us on the next steps. We are very concerned.
Yeah. So given that concern, how prepared are we for a second wave? What measures are in place?
Oh, no, we actually have quite a number. Our provinces, we've deployed teams there who are actually working on it. We do have a plan as a country, which we've developed together with the World Health Organization. It's called the Resurgence Plan, where we really put in particular levels on what we'll do when we come to this level. So we have a plan. It's been circulated to the provinces, and our teams on the ground are actually training the people in different provinces on what to do, so that whenever we really see numbers increasing, we just activate what has been there. You will recall that when we were really in June and July, we had a lot of measures put in place. We've not dismantled those measures, but we've just maintained them just to ensure that we are able to reactivate as soon as we pick up that there are problems.
Yeah. So, I mean, lots of those COVID-19 treatment centers at the ICC, etc., in the Western Cape have been shut down. How do you prepare for a second wave when some of those facilities are now no longer there? Do we have enough beds? Do we have enough oxygen tanks, etc.?
Yes, we do. And once more, just to alert the public, that we made a lot of preparations, and we did not use all that capacity. So the president, through the Presidential Coordinating Council, did actually make an announcement even to the premiers that we don't need to dismantle everything, but those that we really think that we can do without. For example, we note that the ICC, since we opened up, starting to have meetings and all of that, we needed to release that. But we do have quite a number of other beds in terms of the field hospital in the Western Cape that are still there and waiting, so that we don't run short of beds should we have the second surge.
Yeah, and then what about the concerns from health workers, DG? I mean, they've been singing the same song for the past couple of months regarding protective equipment. The president has also been singing the same song, as well as the health minister, that you're going to get there, they're going to get the PPE that they require. Are you finalizing that? Are you satisfied with the protective gear that nurses have?
Yes, what we've done as a department, firstly, we do agree that there have been issues with the personal protective equipment, mainly through the quality. So we're implementing a quality assurance mechanism now to ensure that people get the right PPE, which is actually durable and it's not of poor quality. So we've done that, but in terms of the quantities and the availability, we're working with all the unions. We've put in together what we call the stock visibility system, which is what we also use for monitoring the drugs. And we've also given access to the unions to that system, so that whenever we get a report from a facility, we want to ensure that it's not only from management, but it's also from the organized labor to say, oh yes, we know this, it's there and it's available at any given point in time. In that way, we are able to monitor, but centrally, we actually have a dashboard that we actually monitor, and we're able to pick up if stocks are running low in one district and in one hospital, and we're able to activate the province. But we also have buffer stock at national, just to ensure that if provinces run short and they can't procure in time, we're able to get that buffer stock to those areas. So for now, we think we are doing well on that level, but of course there will be some pockets of areas, and in that area, the minister has been very clear with the MECs that if at any given point in time there's no PPE, people should not be exposed. So no PPE, no work, and there should be consequence management for those managers who are unable to provide PPE to the workers.
Yeah, and one last question. I know that you obviously don't have the final say on this because it's a collective decision, but when we get the second wave and we see more and more people being infected because the economy is now active, do we actually go back to stricter measures in the future?
Yes, I'm happy your preamble was very correct, that obviously that's the presidential prerogative. What we will do on our side as health, we will be providing, every week we provide information, the analysis, the numbers, and where we think the trends are going. And then at the end of the day, obviously, we're being backed up by our scientific advisory committee. Then we take that to the National Coronavirus Command Council, which is chaired by the president. Then we do give our own proposals, but at the end of the day, the NCCC and the cabinet will make those decisions based on our.
I had to try. Thank you so much for your time. Appreciate it. Health Director-General Dr Sandile Buthelezi.